Welcome to my podcast. Today I'm going to talk about another case scenario, which is something I have seen some time ago. And the patient is usually a young boy or a girl in their 20 or early 30, and they are kind of athletic, who is a runner, and they are fit and well, and they will tell you that, doctor, I'm getting this recurrent rash, which is itchy mostly in my body, abdomen, axilla, upper or lower limb, and it's just affected me. And he might relate it to certain ingestion of food. Say, for instance, he say, I do it after I run after the breakfast, and I just developed this rash, and I don't know what's wrong. I tried OTC, different pills, and it's not working, and it's really affecting my life. So you'll just, after, of course, you introduce yourself as always you agreed, double check the patient name and date of birth, and took the short history I just mentioned. You'll ask, do you have anything in mind, or do you have an idea what might be the reason for those symptoms you develop? And have you tried anything so far? And do you have any past medical history that I should know about, like allergy and family history of similar illness? And of course, if there is a medication that the patient takes on a regular basis, and what sort of lifestyle do they do, and whom they live with, and what is their current work, if it's in the field or in the office. And then, as the patient explained, that it occurs mainly after taking any sort of food or breakfast with a few hours, and after you excluded the other known causes, like, for instance, if you are starting to think about urticaria or allergy, you will just need to exclude the other precipitating factor. In that regard, you will come up with something called food-dependent exercise-induced anaphylaxis. And this has been found that it's happening always after consumption of food, which the patient is sensitized to. And patient might be able to tolerate causative food allergen when it's consumed or taken with each other. And it has been stated that this sort of allergy, which is food associated, constitute like 0.001 to 0.1 to 117 percent, and it's accounting for about 30 to 50 percent of the cases generally presented with this sort of presentation and complaint. It has been found that most of the principal allergen, as we all know, beside, of course, the milk and eggs that we always knew about, and seafood, it has been stated certain seeds, grains, and nuts, obviously we know, and certain vegetable and meat has been implicated, and in certain cases. And sometimes it can happen also with any food ingestion shortly before starting the exercise. So this is the association between them, that you just ingest or engulf your food, and then you start to exercise, and you'll just get this sort of allergy. It has been stated also it can be like an amplifier for certain anaphylaxis. So some factors has been found, like, for instance, if the patient is ill, has an infection, if the patient taking certain medication, as I asked already early on, like NSAID, or if the patient is taking alcohol, or have, like, for instance, psychological issue or stressor in their life, women, if she's in premenstrual cycle or ovulatory phase, and also on fever. And of course, if the patient is allergic, like for instance, if he has history of asthma or mastocytosis, so in that condition, it will be extreme reaction and can be a strong like confounder for presenting this sort of allergy. And of course, we know once any patient has anaphylaxis sign or symptom, they will have this sort of flushing, generalized itching, erythema, and it can progress at times to the typical picture of the anaphylaxis, which is urticaria, angioedema, dyspnea, and bronchospasm, which is life serious, of course. So after you just tackle all of those sign and symptom, their linked and association, and what can be the relieving and the precipitating factor, you will base your clinical diagnosis on those kind of symptoms, and you need to review what sort of things that the patient take in order to know the known allergen. And maybe you will send for them for certain investigation like skin break testing, and there is another test called supervised exercise testing in order to expose the patient to the provocative allergen. But you have to be under supervision because you need to treat it, of course, once it's triggered. And then you'll explain to your patient what might be the issue for this kind of condition. And you will come up to an agreed management whereby to minimize the occurrence of this. So it's always wise to state that you need to avoid the triggers, and you have to be aware of those signs and symptoms once they happened, and with timely emergency management whereby you will prescribe adrenaline auto-injector, which they will inject once they feel that this sign and symptom is impending, especially if they have angioedema or laryngospasm. Also, you will give oral antihistamine, corticosteroid if it's indicated, and of course if it's asthma and there's element of bronchospasm, you will prescribe beta-2 agonist. For the exercise-wise, you will tell the patient avoid the triggering factors. So for instance, the patient said that I just have my food as a routine, then I go for exercise. So you'll tell him break this cycle. Maybe you can do the exercise without eating, or do the exercise after some time elapsed since you have engulfed your food. And because if the patient knows about those triggers, it's easy to avoid or change or modify. And to have the exercise, as stated, try to change the routine or the way how you do it in order to break the cycle and see how things goes. And always red flag the patient, as I say, if their symptom increased, if they had like symptom of anaphylaxis. So you need to tell the patient what's those signs, as I mentioned, when it's like heave-like skin itching, which is a red skin with itching, and if the patient can't breathe and have like angioedema or difficulty breathing due to bronchospasm causing dyspnea. So you need to red flag the patient about all of those and tell them you need to go to the A&E or have your auto-injector. So by that, I hope that I covered one of the cases that I might encounter, the clinical setting, or generally speaking, in anyone that you know, and how to tackle it basically, effectively, and efficiently based on the symptom presented. Thank you.